hand hygiene compliance, and hospital-acquired infection rates. Hand hygiene is believed to be a critical factor in preventing hospital-acquired infections because the transmission of pathogens in the healthcare setting or any setting in general often occurs through the hands. To prevent the spread of infections, it is important to remember to wash your hands. Hand hygiene compliance is essential in stopping the spread of nosocomial infections. Is there concrete proof that shows a connection between adherence to hand hygiene and the rate of hospital-acquired infections? In this presentation, we will look at 3 different studies that have been conducted regarding hand hygiene and its impact on nosocomial infections. In a meta-analysis review conducted by V. Moju et al. In 2022 regarding hand hygiene adherence and the prevention of nosocomial infections, reviewed published literature to determine if there is a favorable stage for healthcare workers to comply with hand hygiene to prevent hospital-acquired infection. A systemic review was performed using the preferred reporting items for systemic review and meta-analysis guideline. A thorough search was conducted using online databases for both randomized and non-randomized controlled trials that examined the relationship between the rates of hospital-acquired infections in patients within the healthcare facilities in high-income countries and compliance with hand hygiene practices among healthcare professionals. These countries were mainly from Europe and North America, with 8 of the studies being conducted in the Middle East and Asia. A systemic review started with 8,039 articles that were screened. After the removal of duplicate articles, 6,657 articles were left for screening. Of the 6,657 articles, only 35 articles were part of the review. See Figure 1 on the next slide for more details. Most of the observations were done in the hospital setting, with the ICU being the most common. 2 of the studies were done in a long-term care facility setting, and most of the studies were done by direct observation, except one of the studies was done using electronic monitoring. This is a detailed description of how the articles were chosen. 8,039 articles were found using different databases as shown. 1,436 duplicates were removed, leaving 6,657 articles being screened, and 635 articles were excluded due to reasons stated. 298 articles were further reviewed, but only 35 articles qualified for the study. The conclusion of this systemic review was non-conclusive. Most of the studies reviewed reported a hand hygiene compliance rate of 60% to 70%. According to the author, a very high hand washing rate is realistically hard to achieve. The adherence of hand hygiene and its connection to hospital-acquired infections demonstrated an inverse relationship with hand hygiene compliance rate reaching as low as 60%. The effect of hand hygiene compliance above 60% showed little effect on nosocomial infection rates. See Figure 2 on the next slide for more details. The study design contained flaws, and it was impossible to determine causality. The only items that can be discussed were general trends. Due to the constraint of the studies, further high-quality evidence was necessary to support the practice of hand hygiene. This is Figure 2, a bar graph that shows the correlation between hand hygiene compliance rate and the number of hospital-acquired infections that were reported. While the previous study could not fully support that hand hygiene and nosocomial infections are related, there are other tests that prove there is a correlation. One of the studies is a quasi-experiment conducted in a 555-bed Level 1 trauma hospital in New York, conducted by Nepper et al. In 2020. The pre-intervention period was done between January 2015 and June 2016. Electronic data collection took place from April through June of 2016 as a baseline, and from July 16 through December 17 being the intervention period. The study is to assess the influence of an automated hand hygiene monitoring system in combination of a performance improvement intercession on hospital-acquired infections. An electronic hand hygiene monitoring system was implemented in 4 areas of the hospital. The hospital implemented performance strategies that involved education, troubleshooting, information sharing, and providing feedback. The compliance rate for hand hygiene was monitored, and the incidence of hospital-acquired infections were assessed in both the intervention unit and the controlled unit for comparison. The intervention phase was split into initial period and subsequential period. These periods were then compared against the baseline period. The outcome of this study shows a big difference after installing an electronic hand hygiene monitoring system. Hand hygiene rate improved from 47% to 77%, with rates greater than 70% being measured up to 18 months after the intervention period. The findings indicated that the time series analysis revealed a significant impact of hand hygiene on the incident rate of colostrum difficile and health care during the initial 9 months of the intervention. The trend continued, and the last 9 months of the intervention did not exhibit any notable changes. This is an example of an electronic hand hygiene monitoring system that was implemented in 4 areas of the hospital. In a study conducted by Kalkachova et al. In 2021, analyzes the connection between adherence to hand hygiene practices and infections acquired in hospitals among medical students. The research employed a mixed methods approach through cross-sectional survey, which included both curriculum analysis and questionnaires. A quantitative method was utilized to assess knowledge regarding hand hygiene, accompanied by self-assessment questionnaires addressing attitude towards it. Additionally, a qualitative approach focused on reviewing the content of the curriculum documents. On the questionnaire was about 250 knowledge questions and 238 self-assessment and attitude questions that were analyzed from students of general medicine that were an average of 22.5 years of age. 72.2% was reported as having insufficient understanding of hand hygiene, and 76% reported having elevated self-evaluation of understanding and adherence to hand hygiene. Notable variations in knowledge and self-evaluation of hand hygiene were observed among individuals with more years of study and having different genders. The analysis of the content also indicates that there are deficiencies in information regarding hand hygiene within general medicine educational programs and or among the students. In summary, it is strongly anticipated that a connection exists between insufficient hand hygiene knowledge and poor self-assessment among general medical students. The research demonstrated that adhering to hand hygiene practices is the primary measure of decreasing healthcare-associated infections. Lack of compliance has been shown to heighten the risk of contributing to infections acquired during hospital stays. Two of the 3 articles discussed prove there is a positive correlation between hand hygiene compliance and nosocomial infections, although all 3 articles agreed there is a correlation. After the coronavirus pandemic, hand hygiene compliance among healthcare workers are more important than ever, and many hospitals and facilities are educating healthcare workers and emphasizing the importance of hand hygiene in preventing nosocomial infections. Everybody, please remember to wash your hands to prevent the spread of infections, to protect yourself, your family, and your patients. Thank you.